Hi, my name is Benu. I'm just going to be doing the central line dressing. This is my patient Lorraine. Just going to show the field. Um, there's no other paperwork anywhere else, just to be secure. All right, so I'm going to go ahead, angle this down. Won't be able to see me that clearly, but you should be able to see my hands. So I'll be walking into the room. Hi, my name is Benu. I'll be the nurse today. Can you please state your name?
Lorraine.
Lorraine, and what's your, can I get your last name as well?
Santiago.
And what's your date of birth?
6/25/95.
Okay. And I'm here today just to make sure, just to change your central line dressing. I'm going to go ahead and give you some privacy. So I'm just going to turn this curtain. And next thing I'll be asking is, have you had any pain today or any pain around the central line? Have you had any pain around the central line? No. Okay. All right. So I'm just going to go ahead and do some hand hygiene. So I'll be washing my hands. I'm going to go ahead, put on my mask. And then I'll be putting on some gloves, putting on clean gloves. All right. Okay, now I'll be opening up the dressing. Have that. So I'll open up the sterile field. I'll place this to the side as a garbage tray. Now I'm going to go ahead and grab this mask. I'm going to place it on you, just so we don't have any, so we could make sure there's no respiratory droplets going into the line, make sure there's no infection. And go ahead and just secure the line, and I'm going to pull the tegaderm around it. It may hurt just a little bit. You're going to do it nice and slow, just so we don't pull the line. And you said you had no pain today, right?
No pain.
Okay, good. All right. So I'm just gonna go ahead and assess the dressing. There's no discharge on the dressing. Patient's central line site has no redness, no edema, no ecchymosis, no discharge, and it's approximated. So I'm going to go ahead and then discard my gloves. And then I'm going to go ahead and do hand hygiene again. I'm going to come back. We're going to just I'm just going to move this sterile field over just a bit so I can make sure I can grab my gloves and open up the gloves freely. We're going to open up the package. Again, just going to move this over just a little bit more. And go ahead and grab this first one. Gloves like this. Grab the next glove. Okay. Just trying to maintain the sterile field. I'm just going to go ahead, grab this, and place it over to the side. And then I'm going to just secure this over here. Next, we're just going to make sure everything is in place. We have our chloropleth, we have our alcohol swabs. Just going to go ahead and grab this 4x4 gauze. I'm going to open this alcohol swab up to clean around the lining. I'm going to use my other hand to grab the central line. And then we're gonna just grab the alcohol swab. Make sure we're cleaning all around the area. So make sure you're going to go inward to out. Make sure we're cleaning the line itself if there's any drainage. Okay, we're going to discard that. Next, we're going to grab the chlor part. Okay, make sure that's opened. And then we're going to swab around in a circular motion. And going from inward to outward in a circular motion. All right. Try and give that some time to dry. I'm gonna go ahead and just prep. We grab this, and the area has dried, so we're just gonna secure the line with this, with the gauze. Okay. Place the line down. Next, we will grab the Techaderm. We will go ahead and open it. Secure onto the patient's line. Make sure we're rubbing out any air pockets. We'll then go ahead and rip off this and make sure it's secured on all the edges. This side. Okay. The line is secured. I would next take off my sterile gloves. Place sterile gloves here. Do my hand hygiene again. Then I would take off the tape from, or then I would write date, time, and my initials. So today's date is the 2nd, July 2nd. Time is 1 o'clock, and my initials are BS. I would take that, grab the tape, and put it on the side of the line so the next nurse can see exactly when the dressing was changed. All right, and that ends today's video. I would also make sure I take off my mask and the patient's mask as well. All right, thank you.